So today we are going to talk about growth adaptations. Before we move forward, let's talk some basic concepts regarding this. So number one is an organ is in homeostasis with regarding to its physiological stress. Second point here to remember is that whether there is a change in type of stress or whether it's increase or decrease in the stress, the cells adapt to it, which is known as cellular adaptations. So the point here to remember is that when the stress exceeds the cell's capability to adapt, this results in injury. Now injury can be further divided into two types. First is reversible, second one is irreversible. We will talk about injury later on. Let's see what are the various forms of adaptations for now. So number one is hyperplasia. Second is hypertrophy. Third is atrophy. Fourth is metaplasia. It is one of the important topic. Fifth one is dysplasia. And lastly we will be talking about aplasia and hypoplasia together, as these are small topics. Now one point here to remember is that adaptations are not permanent. They are reversible. When stressful conditions are withdrawn, the cells reverts back to its original form, which shows that adaptations are reversible. So moving forward, let's see the various forms of adaptations in detail. So first we will be talking about hyperplasia and hypertrophy. This topic is further subdivided into three subtopics. So first one will be definition, then we will talk about mechanism, and lastly we will be seeing the examples of this. So first let's talk about definitions. So when there is an increase in the stress, the cells adapt, and the response to these adaptations is seen as size of the organ increases. Now this organ size increase can be via two methods. First, either the cell size increases, in which a small cells grows larger, or number of cells can be increased. In this, one cells divide into form many daughter cells. Now when the organ size increases via increase in cell size, this is called as hypertrophy. While organ size increases with the help of increase in number of cells, then this is called as hyperplasia. So these are the basic definitions of hypertrophy and hyperplasia. Now some points to remember are: first is generally hyperplasia and hypertrophy occur together. Common example for this is uterus in pregnancy. The second point here to remember is that permanent tissues, as you know, never forms new cells. No new cells are formed. Hence, it does not show hyperplasia. It shows only hypertrophy. So you should basically know what are the permanent tissues. First is cardiac muscle. Second is skeletal muscle. Third is nerve. Example of this is cardiac myocytes, which only undergoes hypertrophy in response to systemic hypertension. Now let's see what is the mechanism of hyperplasia and hypertrophy. So let's see the mechanism of hyperplasia and hypertrophy. First we will be talking about hyperplasia. This is a very simple mechanism. It involves stem cells activation, leading to new cell production. While hypertrophy is a bit different compared to hyperplasia, this process occurs via gene activation that leads to protein synthesis and organelle production. So these are the mechanism of hyperplasia and hypertrophy. A point here to remember is that long-standing pathological hyperplasia can lead to dysplasia, eventually causing cancer. So this is a classical differentiating point of hyperplasia and hypertrophy, as hypertrophy does not causes dysplasia, neither causes cancer. A classical example for this is endometrial hyperplasia. And exception to this is, as you know, exceptions are always present. Exception to this is benign prostatic hyperplasia, which does not increases the risk of prostatic cancer. So now we will talk about examples of hyperplasia and hypertrophy. First, let's say example of hyperplasia. Now examples of hyperplasia is divided into two categories. First is physiological hyperplasia and second is pathological hyperplasia. So example of physiological hyperplasia is liver post partial hepectomy, that is after partial hepectomy of liver it regrows. Second is breast during puberty. Breast in puberty. Now pathological example of hyperplasia we have seen earlier. First is endometrial hyperplasia. Second is benign prostatic hyperplasia. Now let's see example of hypertrophy. It is further divided into two categories, physiological and pathological. Physiological hypertrophy. First example is uterine myometrium in pregnancy. Second is seen in skeletal muscle in bodybuilders. We generally see this in our daily life. Pathological example is left ventricular hypertrophy. With this, we have finished our topic of hyperplasia and hypertrophy. Moving forward, we will talk about atrophy.